the public's trust that, yes, we feel something like a Diamond drink or whatever it is a legitimate, worthwhile, and will accomplish the results that you're describing.
No, thank you. That's a very those are all very good points. And the public does seem to be with us in terms of their understanding the need for treatment in lieu of incarceration, even supporting an increase in the alcohol fee. I think that we've established. We built some real linkages under Prop 36 with law enforcement because the program required us working together with probation to do this program. I think that they, really began to see the importance of treatment linked with the public safety issue. I don't know that all of law enforcement has gotten that message, but I think you folks could be helpful there. And when we have the data showing the effective, the results of treatment, that it is effective, and frankly, we're putting a great deal of money into supply reduction efforts that have a pretty dismal record of success. I mean, less than 10% of the drug supply is being intercepted, and yet the public seems to, be okay with just funneling more and more money into that. I mean, that is the bulk of the federal drug control money right now. So I think that it's a matter of educating and just helping people to understand that treatment is an effective alternative.
Well, I would also point out that in 2000, 61% of voters decided that we would spend $120 million a year on treatment instead of incarceration. The legislature has not kept that up. So I would say that the legislature is not at risk of getting too far ahead. I would say the legislature is far behind.
Danny.
Thank you, Mr. Chair. And I just want to touch on a little bit my colleague, Mr. Skinner, made there, is that it is a trust issue with the public currently. I mean, the legislature will designate a particular fund to be spent on a particular issue. And what do we do here in this building? We take that money and we spend it other places. We've earned over a period of time the mistrust of the public. I can see this is a huge problem. I spent 3 decades wearing a uniform. Mm-hmm. I know the issues of drug and drug abuse and incarceration. I'm very, very familiar with it. And I pray as a legislative body that we can come together as a body for the people of the state of California so that they do have the trust in this institution that we are designating funds mm-hmm. and spending the funds as we say we're going to spend them. Mm-hmm. And that's the challenge for us. As my colleague mentioned, we spend most of our days of people continually coming into our office and asking us for more money. And don't cut this program, don't cut that program. Believe me, I'm a public safety guy all the way. I'm an education person, just as these other members here on the committee are, and home health services and those that need help. I drive down 12th Street and look at the homeless, and many of those are drug addictions. So we have huge problems facing us, and we do have to prioritize where we're going to spend these funds. The limited funds we have, as it's pointed out, our Bank of America card's maxed, our MasterCard's maxed, and we don't qualify for American Express. I mean, we're in some tough times. Thank you.
Assemblyman Gilmore, thanks for those good comments. I just remember with Prop 36 that our field didn't come asking for this program or asking for this money. The legislature did not come up with this idea. The voters said, we want this program and we are going to put $120 million a year into this program. Now, it was after 5 years, then it was the legislature's or the state's obligation to really, continue the program, and the state didn't do that. So I would say at that point, that was the state probably subverting the will of the voters.
Okay, thank you, panelists. And we got some additional public testimony, and now we'll start that. We'll keep you on track. We have brief comments. We'll call Tim Saylor Warren Daniels, and David Warren in that order. So first we'll hear from Tim, and then Warren Daniels and David Warren. You can identify your organization. I appreciate you being here.
My name's Tim Salyer. I'm with the California Therapeutic Communities Association, which is essentially a nonprofit that is an association of all the in-prison and a lot of the community-based providers that are in the SAP-SASCA system. And so, you know, we've heard a lot of testimony today about, you know, concepts and theories and reports, et cetera, et cetera, et cetera. But I mean, I think the reason, the bottom line is dollars. How are we going to pay for this? I think everybody agrees. I mean, all the statistics and all the reports for the last 10 years show that effective substance abuse programs work. They reduce the recidivism rate from anywhere from 20% to 50%, depending on how effective the programs are. So my question to the legislature is, if we can show you a system, a delivery system, that actually saves money from day one, is budget neutral, or saves money from day one, and will save hundreds of millions of dollars every year after year one, would they consider it and look at it in a serious way? Because we have taken these reports, we have taken the LAO's reports, we have taken the OIG's 2007 report, we've taken the data from CDCR that shows recidivism reduction of 18.5% per year over a 2-year period. We've taken all that data and we've put it on a spreadsheet. And we've factored in the cost of incarceration. You know, the numbers range from $134 a day by dividing 170,000 into 8.5 billion to, well, that's not really the cost. The incremental cost is $93 a day, or sometimes they say it's as low as $63 a day. I've taken those numbers and put them on a spreadsheet. I'm using CDCR's numbers, I'm using their data, I'm using the OIG report data. And we have a model that combines 1453, DTF, SB 18, and SB 618 that from day one saves the state money, and we can show you where those dollars come from.
Love to see that.
Okay. How do we get it to the right people who will act on it?
Well, I'll tell you one thing right now. The budget process and looking for options is going to be a completely open process. The speaker has made a statement that we're going to have full budget hearings in the committees, and the speaker would like to hear all suggestions from the community about how do we deal with our budget issues. So we'd love to have your input into the budget subcommittee. I'm on it. Jerry Hill's the chairman of the committee, and we'd love to have your input on this.
If you don't mind, I would suggest.
Perez has really made a public.
Okay.
He's said it over and over and over. In fact, we're talking about having hearings throughout the state. Correct? We'll have hearings all over the state of California on the budget issue and the budget, how to solve the budget problems.
Okay. Well, I would welcome an opportunity to sit down with that committee, but also with the LAO's office, and ask them to look at this model and say, it's not right, your assumptions are incorrect, or whatever. And I welcome that.
Okay, thank you.
Okay. May I say one other thing real quickly?
Yeah.
The CDCR budget in the last 5 years has gone from $3.5 billion up to $10.5 billion down to $8.5 billion. The number of parolees and the number of inmates served during that period of time has remained constant at 170,000 people. The number of parolees serviced every year is about 120,000. It's remained constant. Someone should be looking at where that increase went, because it didn't go to treatment, and they're not serving any more parolees and not serving any more inmates.
Thank you, Tim and Warren. And then we'll have David Warren. David is here. David, are you here? David Warren. Okay, Jim Lindberg is the last speaker. And then, okay. David Warren left, and Jim Lindberg is the last speaker.
All right. Thank you, Assemblymember Bell, and thank you for this committee today and taking the time to look at these issues. I didn't prepare any, fancy comments or anything like that. I think the numbers and the results of treatment continue to speak for themselves. My name is Warren Daniels. I apologize. I'm with the California Association of Alcoholism and Drug Abuse Counselors. We represent about 7,000 counselors in the state of California. Earlier, Deputy Director Geiger from CDCR didn't really toot her horn as much as she should have and talk about the program a little bit more that KDAC has worked on with CDCR and training inmates in the prison at a very, very low cost, and then them providing services in the prisons and providing them with jobs when they get out of prison. We've been very successful with that program, starting it in San Quentin in 2006, and hopefully they will continue providing those services in the prisons. In addition to that, I've heard a lot of information today about the decimation of the treatment system in the state of California. One of the things I haven't heard talked a lot about is the jobs in the workforce of some 21,000 that continues to be in a crisis. And my understanding is that as part of the federal stimulus package, over $480 million came to the state of California for job development. Not $1 of that funding went to support programs for training treatment professionals. On any given day, our average workforce is Caucasian, over 50, and for every 2 we lose, we get 1 back. Over 40% of the people we treat are Hispanic, but yet our Hispanic counselor population is less than 10% of our workforce. So I know you've got a lot of hard decisions to make. I certainly have appreciated your concerns and comments. We will be there to testify any place you want us to. And we certainly appreciate your continuing to carry legislation and fully support AB 1694 as well as some of your other bills. Thank you for your time.
Okay, Jim?
Thank you.
That will be the wrap-up speaker.
Okay. Oh, I better be good. Jim Lindberg on behalf of the Friends Committee on Legislation of California. Quakers invented the modern penitentiary, so to speak, and so have had a long historical interest in reducing our addiction to incarceration. I think that the voters really are the higher power here in their wisdom in passing Prop 36, and I think we're in denial if we think that cutting funding for drug treatment can be scored as budget savings. I mean, technically that's what we do, but we're certain that the more we disinvest in drug treatment, the more that the prison system becomes the solution by default. The UCLA evaluation said that we save $2.50 for every dollar we invest in Prop 36. I believe it also said that if we fully funded drug treatment to the level that is required so that everybody who is eligible could get the level of service that they require, that savings approaches $4 for every dollar we invest. It's true we have a terrible revenue problem in this state right now. In 2004 and 2005, there was enormous enthusiasm about the Department of Corrections, and it's shifting its emphasis away entirely from punishment and more of an emphasis on rehabilitation. In fact, we even changed the name to include rehabilitation in the name. Since then, in 2007, the legislature passed AB 900, which will eventually add $40,000 prison beds. This was billed as reform, we think, because the legislation also included $50 million for programming and would require every new bed to include programming. But as we've seen this last year, we've now cut programming by $250 million, which offsets that about 5 times. So it seems like we have a perfect storm now where we're going to be adding all these new beds. We're going to require that there be space for programming, but there won't be any funding for programming. In addition, the LAO has said that the operational cost of these new beds will be about $1.3 billion per year. I'm sure by the time they're constructed that they will go up even more. So one thing that has resulted is that the federal courts have gotten involved in ordering population reductions in order to bring prison health care up to constitutional levels. And they have said in their ruling, or I probably should say they have begged in their ruling that
30 seconds.
Thank you. One way that we could do this would be to reduce levels of incarceration so that we're not incarcerating people who provide a low risk to public safety, and to put them into community-based treatment. And by doing that, they said that we could also increase public safety and also save the state money by doing so. So we would just urge the legislature to restore funding for treatment and for programs. Thank you.
That's our last request to speak part. I'd like to thank our presenters sincerely for attending this hearing, and thank both the members of the Assembly Select Committee on Alcohol and Drug Abuse and the Select Committee on Prisons and Rehabilitation Reform, and especially thank our co-chair of this endeavor, Alberto Tarico. And we've heard a lot of information today. I want to make a commitment today that I will work to develop options to consider in the budget hearings that will look at the long-term effects of different directions. We come to a fork in the road here. If we go the directions of just cutting out all the treatment programs and shutting down 80% and closing down, I know as a former city council member, once that conditional use permit is lost, it'll take 3-4 years to get it back. In a lot of communities, they just won't vote for reestablishing those use permits. So a lot of the programs, if we cut 80% of them and they go bankrupt and the programs shut down, we're losing those beds in the community, the treatment programs. So it'll take decades to bring it back up once that's destroyed. So it's not a matter of, oh, we'll decide in a couple of years when the time gets better to refund them. It'll take decades to bring those treatment slots back. So I will work with the community to develop some options in terms of the budget, and let's all work together. And we can work together in terms of what the fork in the road will tell us. One way will be to just continue to go the directions we're going and reduce treatment for programs. The other direction is to redefine what we're going to do with our criminal justice system and increase treatment options and reduce the amount of beds in the future growth of the prison system. So we have to make a decision which direction we want to go into. And I think the direction of increasing rehabilitation and treatment is the fiscally and the morally correct direction to go. We have to have a balance between incarceration and punishment and redemption and rehabilitation. And I think most justice systems are based on that careful balance between redemption and punishment. And I think if we have a system because of our budget that goes only towards punishment, that's in the ultimate sense not a system of justice that I want to have in California. So thank you all for coming, and we'll continue to work throughout the year in terms of the budget to come up with some options to look at. Thank you.